Hey guys, it's Justin from Justin's HIV Journal, and today we are going to talk about, or tonight, we're going to talk about the coronavirus. Now, as you know, most of you know, I live in Maryland. The governor of Maryland, Governor Hogan, just announced a state of emergency, and we didn't think that we, of course, were in a state of emergency, but I think that he's being proactive at this point. So if you go to the website, the Maryland State government website, you'll see that the number of patients tested for the COVID-19 virus, which is the coronavirus, the technical name, 31 patients have been tested for it. 14 are out of those 31 are pending. 17 have come back negative, and 0 have come back positive. So I think what Governor Hogan is doing is he's being proactive. He's trying to make sure he stays on top of it, trying to stay ahead of it. All means of the words, trying to be prepared, because supposedly, from what I gather, that a lot of scientists are saying it's going to happen. So it's kind of scary, but here's also the thing. I have HIV, right? So there are a lot of people that have suppressed immune systems. So they say that the coronavirus is, right now there's no cure for it. So they say that the symptoms are fever, cough, pneumonia, and shortness of breath. So those are the 4 main symptoms of the coronavirus. So that it's like symptoms might come from 2 days to 2 weeks, so 2 to 14 days. The prevention, of course, are let me just actually read this coming from the website. Wash your hands frequently with alcohol-based hand sanitizer or soap and water. Cover your mouth and nose while coughing and sneezing. Probably not with your hand, but probably with your sleeve. That's what they're probably saying when they say that. Avoid close contact with people who are sick. It's kind of an obvious one right there. If you're sick, stay home from work or school. Avoid touching your eyes, nose, or mouth with unwashed hands. Practice good health habits, meaning wash your damn hands. Make sure you wash your hands. Go to the bathroom, wash your hands. You know, if there's hand sanitizer, use it. There's no point of not using the hand sanitizer. If it's there next to the door, use the hand sanitizer. Possibly save your life and somebody else. So, they say they can diagnose the coronavirus at a special lab or public health laboratory. Clinical laboratories do not have the ability to test for this particular virus, though they do have the ability to test for other more common coronaviruses that circulate in people all the time. So, dealing with the different strand here. So it's a novel virus. It's this very scary here, and the important thing is to not panic and not contribute to a public hysteria that might cost lives. Meaning, not to, just because somebody's wearing a mask in public doesn't mean you have to attack them, because I've actually read stories now that people are attacking people with masks because they think that they're sick. Well, if you're attacking somebody who you think that might be sick, you're going to get sick too. And also on top of that, the stigma of being sick is being perpetuated through people attacking others, and this is just not right. So it's definitely being already stigmatized in the public eye, which is upsetting. So, the guidance that Maryland's providing is the best guidance I can see. Things like it looks like that the Maryland Department of Health is kind of staying on top of it and trying to do their best, staying in front of issues. So, in front of this issue. So it's kind of also China. I mean, where it first came from, is saying that they had little link to seafood and humans. So they had they were linked to seafood and animal market in Wuhan, And so, but officials, of course, are saying, of course, human to human transmission is more than likely of how it's going to spread more rapidly throughout the human population, rather than, of course, through animal to human. So, state of emergency for Maryland, and basically just making sure that they stay on top of it. But do not panic is one. Make sure you wash your hands. Make sure you use hand sanitizer whenever you're in a populated area. Just be careful. Stay away from people that are sick. Do what you need to do to protect yourself, but make sure when you do that you're not harming anyone else. So, just wanted to make sure that people know and people are informed. So I will talk to you later, and looks like they have said that, they are looking at Montgomery County, Maryland, as maybe one of the places that might have an infection or two, or right there. So, and that's where I'm from, Montgomery County, Maryland. So it's a little scary there that it's like from my area, but I'm not surprised because it's a highly populated area and it's right above DC. So, I don't live there now, but I got relatives there. So, anyway. Just wanted to let you guys know that you guys should just stay informed, be careful, and I will talk to you later. Bye.